Hi, I'm Dr. Seanna-Kaye Denahm, the Chief Experience Officer here at New York City Health Hospitals, Kings County, and this is my YouTube podcast takeover. Today, we are going to be talking about the importance of employee morale, especially here at New York City Health Hospitals, Kings County. Employee morale. So if I were to define morale, then I would define morale as the energy and commitment that it takes to perform a certain task or to be affiliated with a certain group or organization. So for me, the idea of that energy and commitment that it takes to work here at Kings County has never been clearer than it has been since the COVID-19 pandemic. We have experienced something that really is very hard to describe, and I know that a lot of people have tried to describe it, but there's really not one way to describe what that experience was like for us here. To see tremendous pulling together, innovation, problem solving, teamwork, creativity, and yes, also to see secondary trauma, compassion fatigue, and challenges around morale. I think that this is something that's being experienced and talked about and dealt with across the healthcare sphere because we had to experience something that none of us could have dreamt about in our wildest imagination. And it pulled out of us, I think, the ability to cope that we didn't even know that we had. And now we are really taking care of ourselves and each other around morale. And that is something that is a focus for us here, regardless of our titles, regardless of where we function in the hospital. It's something that we're all keyed into. And we want to continue to be that employer of choice for Central Brooklyn. There is something about working at Kings County that is unlike working any place else. And I've worked in the private sector, in the public sector. I've worked in different environments, but there is something about working here where you know that you're making a difference in what you're doing, where people come here for their health care and they come here to for everything regarding their health care because everything is here, or we're going to get you connected to the care that you need. So that aspect of working in an environment that is so inspiring is, I think, one of the fundamental components of employee morale here. Then we have a commitment to listening to each other. You know, on a weekly basis, the senior leadership here rounds and they talk to staff directly face to face about what brings them joy in work, about what's a barrier to the work that they're doing, about those pebbles in their shoe, about what matters to them, and how we can work together to improve the work life here and our Kings County family. What can we do to make things better? What's within our control? What do we need to escalate? How can we advocate for the environment here to be one in which people can flourish in their current assignment, where they can find mentorship, where they can grow, where there's a path of succession, where they can be connected and committed to purpose, and where they can have the resources that they need. And I think that those are components of what it takes to have strong morale here at work, to know that you are valued, that you are listened to, that your voice matters, and that we're committed to take this journey together, and that we're not in this for any other reason than to give the best of ourselves to provide the best care that we can possibly provide. And so that's how I feel about the importance of employee morale here at Kings County Hospital. I'm so interested to hear your thoughts and ideas. So if there's something that you want to share, definitely reach out, feed that information back so that we can grow together. Thanks.